morning, I'm Lieutenant Melissa Berry, and I am the clinical nurse educator that is going to be proctoring this physical health exam for Amanda Funderburk.
I'm Amanda Funderburk. I am a nursing student at Liberty University, and I will be doing my comprehensive head-to-toe exam today. So the patient's vitals have been taken, my hands have been washed, and my gloves have been donned, and vitals are within normal limits. Good morning, how are you doing?
Good, how are you?
I'm doing well, thank you for asking. Can we do your head-to-toe exam today?
Sure.
All right, so we're gonna touch all body parts from across the room. I realize that the patient is alert, that his skin is nice and pink, and he's engaging with me. So we have consent, we're gonna go ahead and do our exam. So I'm gonna start with just overall skin, pink in color. We have some freckles noted on the face and some facial hair, mustache and beard, but no obvious bruises, cracking or peeling of the skin, lesions, or anything of that sort. On the upper extremities, we also have some tattoos and looks like some scarring on the left elbow. Tattoos and scarring down the right arm, and skin is still pink in all the extremities, smooth to touch, and it is warm in all the extremities. Toes are a little bit cold, but they have nothing on them. Turgor, he is not tenting on his hands or feet, so nice and moist. We'll go ahead and do some cap refill. His nails are nice and adhered to the nail beds. Do you like this for me? There's no ridges or contouring. There's no acrocyanosis. They're clean, well maintained. Bilaterally, that cap refill is less than 3 seconds on all 4 extremities. All right. So moving on, gonna inspect the scalp. So the hair is evenly distributed. It's thick and black. It's not like breaking or falling out. A little bit of a receding hairline. No lesions or bumps. No tenderness when I'm palpating. Patient's not grimacing. On the face, same thing. I'm not feeling any deformities, masses, any crepitus, and not seeing any obvious deformities. Any tenderness when I palpate your sinuses? Okay, no tenderness with paranasal sinuses. Also the lacrimal ducts were felt and they are not palpable. There's no swelling. Can you move your jaw side to side for me? Okay, and then open and close your mouth. No clicking or popping of the TMJ. And while I'm here, I'm gonna go ahead and palpate all of the lymph nodes. Preauricular, postauricular, submandibular, down the cervical spine or cervical chains. And none of them are palpable. Also noted when I came down, the tonsils are not swollen or anything for when we get to the mouth. I shouldn't expect to see them edematous. All right, so we're gonna move on to your eyes. Eyebrows, eyelashes are nice and full. Eyes are symmetrical to the face. Sclera is nice and round. There's no discoloration. They're nice and white. The iris is green, brown. Pupils are nice and round. There's no scratches or hemorrhages or anything noted. His mucosa is pink and moist. Conjunctiva, no drainage coming from it, and nice and pink as well. So gonna make sure that there's no strabismus, checking just for that symmetrical light reflex in the pupils, which is there. And also I'm gonna check pupillary reaction while I'm here. So I want you to just look straight at me. Okay. Pupils round and equal and reactive to light. We are going to have you follow my finger. We're going to check our 6 cardinal gazes and just make sure that there's no extraocular movement. Cranial nerves 3, 4, and 6 are intact. All right, so follow my finger. Patient accommodates. And then we're going to do the cover-uncover test. So this is going to be looking for just stay looking straight at me. Any extra adjustments that the eyes are making as I cover and uncover, and they look symmetrical. Next, we're gonna check your visual fields. So if you will cover your right eye for me, and let me know, see if I can get eye level with you. Let me know when you see my hand come into view.
No.
Okay, other eye.
No. No.
Okay, so equal to my visual fields. Okay, so now we're going to get our ophthalmoscope. It's already been preset. Looking for that red reflex. And I'm gonna move in and look in the back of my eye. Look up for me. And down. Other eye. And down. Okay, so the optic disc has symmetrical round border. The nerves, the AV are ratio 2 to 3, not overlapping. We don't have any exudates or hemorrhages, and the macula and fova centralis are normal color and have clear borders, clear defined borders. Alright, so we're gonna move on to your nose. Let's check and make sure it's patent first. So if you'll cover one nostril for me, take a sniff. Alright, other side. Alright, nose is patent. So take a look up there. So pink moist mucous membranes. The septum is midline, and I am not seeing any turbinates or polyps or foreign objects in the nose. So we are going to do a little test. I want you to close your eyes for me, and I'm going to put something under your nose, and you tell me what you smell, okay?
Alcohol.
Okay, that was an alcohol swab. Keep your eyes closed, and we're going to do it one more time.
Coffee.
It was coffee. Alright, so olfactory cranial nerve intact. You can open your eyes. Alright, moving on to your lips. So nice and moist lips, no drying or cracking, not seeing any like ulcerations, mucous membranes inside the mouth, say ah, are all nice and pink as well. Say ah again. Soft palate and uvula do rise and are midline. So cranial nerve 9 is intact. I want you to stick your tongue out for me. Wiggle it side to side, up and down. Alright, so not seeing any like cracked missing teeth, any extra lesions or anything with all that movement. And again, cranial nerve 9 is intact. Then cranial nerve 10 would usually be checked here. So we would use a tongue blade and put it in the back of your mouth and check your gag reflex. We're not going to do that to you. So. Ears, nice and pink in color, no masses in front of or behind the ears. Don't see any drainage coming from them. So I'm gonna take a look inside. There's some nice earwax in there. Okay. So bilaterally, the light reflex is noted on your tympanic membrane at the appropriate location. Tympanic membrane is nice and opaque, a little bit of fluid behind it, but no redness of the ear canal, and the umba and the other structures of the ear are in the correct location without any deformities or discoloration. Might consider an ear lavage for some of that earwax in there though. Alright, I'm gonna touch on your neck. So checking the spinous process, just down the cervical spine, making sure there's no step-offs, making sure there's no crepitus, it feels midline. And then in the front, checking these carotid pulses. So they are 2+. No bruit. Okay. And then I would have you swallow. If you can't swallow on your own, we have some water for you. Can you do it again? Okay. So thyroid moves up and down with swallowing. It's not enlarged. Now I'm going to take a listen to it as well. No bruit there either. All right. So skin of the neck, just like everywhere else, has been nice and pink. It's warm. No jugular venous distension. Trachea is midline. Everything looks good on the neck. So we're gonna take a look at your chest. You okay with me unsnapping your gown? Okay. All right. So first I'm inspecting. So we have some chest hair, a couple of scars noted, a mole, but nothing out of the ordinary as far as like lesions, rashes, no big bruises, not seeing any deformities. When I palpate, is there any tenderness? Also not feeling any masses or any crepitus or anything. Take a listen to ya. Deep breath for me. Don't pass out on me. Okay. So interior and posterior, I want to listen to those lungs. So take another deep breath for me. Just comparing both sides, making sure that we're listening to all of the lobes. And no adventitious sounds are noticed. You're clear bilaterally. While I'm listening, I'm gonna go ahead and listen to your heart. So aortic, pulmonic, mitral and tricuspid valves. S1 and S2, sounds noted, no extra 3 or 4s, no murmurs, regular rhythm and rate. You're also breathing without increased work of breathing, symmetrical expansion of the chest. I'm gonna come around back and I'm just gonna put my hands on your back and make sure that I can see for myself with my thumbs coming apart when you take a deep breath, that everything's symmetrical. Wonderful. All right, so we'll start in the back since I'm already here. And we're gonna have you say 99 each time you feel the ball of my hand touch your back.
99, 99, 99, 99, 99, 99.
Okay, so just comparing the tactile fremitus there, and it is resonant throughout. And now I am percussing. Everything is nice and resonant. So I'm gonna do the same thing on the front. We're gonna start with the 99.
99, 99, 99, 99, 99, 99.
Okay, and we're gonna percuss. Nice and resonant. Okay. All right. I'm going to have you lay back for me. All right. So we're going to move on to your abdomen. I'm going to take a listen to your abdomen before I palpate. I'm just checking for vowel sounds in all 4 quadrants. Did you eat breakfast this morning?
Yeah.
A little bit hypoactive vowel sounds, but they're present in all 4 quadrants. And then I'm going to listen to the aorta. No bruit or thrill or anything noted. I'm also going to try to auscultate the portal veins. And no bruit or thrill there either. All right. So skin on the abdomen, some stretch marks, some hair noted, but again, no masses, no bruising, no rashes noted. So I'm going to go ahead and I'm going to palpate. Start with light palpation in all 4 quadrants. Still nothing notable. Go back around and do deep palpation. Any tenderness? Want to do that? Okay. So no tenderness. I'm going to feel for your kidneys. And they are not enlarged. We're not feeling big old kidneys. All right, so I'm gonna find your spleen here. All right, so we have like about a 3 centimeter area where I'm not really hearing resonance. The spleen is probably located here. And when I palpate, it is not enlarged, it's not palpable, okay? Same thing with your liver. All right, so about 7 centimeters for that liver. And same thing, if I do some deep palpation under your ribs here, not really enlarged. So no concerns You wanna sit back up for me? Oh, I'm just kind of throw this over you. So we did your heart, we did your carotid pulses. I'm gonna go ahead and check all the other pulses. And for varicosities, I didn't notice any edema in your feet, but I'll also check to make sure that there's no pitting edema there. So temporal pulses are 2+, regular rhythm. Nice strong brachial pulses, 2+, you can relax. Radial pulses also 2+, and equal bilaterally. This one is hard to find. I would say popliteal pulses are deeper, so I feel it at like a 1+, but they're definitely equal bilaterally. Just gonna feel back here near your ankle for a pulse as well. Your feet are pretty cold, and you're dangling them, but you still have good pulses here. Bilaterally. Definitely 2+ in these pedal pulses. And dorsalis pedis. Okay. Alright, so no varicosities, and no edema in the lower extremities or upper extremities. Alright, so one more thing before I make you start moving around a little more. Could you pass me that card there? Okay, so we're just gonna have you take a deep breath out and hold for me. Can you slide a little to the left? Outside the camera. Okay. Are you holding that breath out? Okay. Now I want you to take a deep breath in and hold. Okay. So we're gonna measure the difference here, and it's about 3.5 centimeters for that diaphragmatic excursion. All right, so we kind of skipped over normal eye exams. Everything looks great with your eyes. Do you go to the optometrist yearly?
Yeah.
Okay, so your primary care provider will usually do a quick check of your eyes, make sure their reflexes are normal, kind of like we've done today. They'll also have you read a chart, has the big E at the top, and you'll read the lowest line you can standing from 20 feet away. That's checking your vision from a distance. And then there's also little cards like this your optometrist can use for the Rosenbaum. So you hold it about 14 inches away, and it just tests clarity for reading, okay? We just want to make sure that you are doing preventative maintenance on your body and taking care of all of your eyes and ears and nose and mouth and all the goods, okay? All right, so I'm going to test all of your range of motion. So I want you to put your arms out for me. Put your arms down, put them behind your back. And now I want you to, you can relax. Okay, you're gonna shrug against my hands. Okay, you're gonna do the same thing with your neck. So look up, look down, look to the left, look to the right. Okay, now you're gonna try and turn against my hand. Try to turn against my hand again. Okay, so strength and range of motion are intact for your shoulders and your neck. Next, we're gonna do your arms. So I want you to, your elbows just up and down for me. Okay, I'm gonna try to keep your arms down and you try to pull up. Okay, and different, of the opposite way. Good. So range of motion and strength intact for the elbows. So wrist, point your fingers to the ground, to the roof. You're gonna point them out, point them in, supinate, pronate. All right, so everything at the wrists are working. Wiggle those fingers for me. Okay, so push down with just your wrists. Okay, and pull up with just your wrists. Good. Now try to keep your fingers closed, or yeah, try to open your fingers and I'm gonna try to keep them closed. Good. Try to keep them open and I'm gonna try to close them. All right, so strength and range of motion also intact in wrists and fingers. All right, so we're gonna check these legs. The best way for us to start is to go back and lay down. Try to give you a little bit of privacy here. All right, so I want you to raise one leg at a time. We're just checking those hips. Okay, okay. Now I'm gonna try to hold them down and you try to raise them up. Okay, now one knee to your chest at a time. All right, and then I wanna take this far leg over top of this leg here. Yep, okay, and opposite. Good. All right, now flex your toes like towards the ground, towards the ceiling. Move them together, like toes together, like the soles of your feet facing. Rotate your ankles. Can you move your ankles like this? Yep, there you go. All right, wiggle the toes. Good. All right, so you're gonna, it will be in the camera. Push against my hands and pull against my hands. Okay, strength and range of motion intact. All right. While you're laying there, we're gonna do a test for sensation real fast, and I just want you to tell me if something is sharp, soft, or dull. Okay, so close your eyes. All right.
Soft,
Soft.
sharp,
Yep, not sharp.
dull,
Dull. Good.
soft.
That is soft. All right, now I'm gonna do your feet. Just bring them back into the camera. All right,
Soft, sharp,
that was sharp. All right. So sensation is intact. Now I have another little tool and I'm going to put it to your toe. It's gonna vibrate and I want you to tell me when you feel the vibration stop, okay?
now,
Okay?
now,
Good. All right. Sit back up for me. One more thing is you should go to the doctor and have an audiogram done or test your hearing if you feel like you're not hearing things clearly, sounds are muffled, you have ringing in your ears. So we just want to do a quick test here to make sure that you're hearing equally bilaterally. So same thing, little tuning fork. I'm going to put it right in the center of your head and I want you to tell me if you hear it louder on one side versus the other, okay?
same.
It's the same in both? No question? Okay. I'm going to touch it behind your ear and then I'm going to hold it beside your ear. Which one is louder?
Beside,
Okay. Same thing.
beside,
Okay. So hearing intact bilaterally. That is good. All right, while you're sitting there, let's do neuro checks. I want you to take your fingers to your thumbs and then bring each other finger to your thumb. Try to get faster. Okay? And then take your palms and flip them on your thighs. Faster, faster. Okay, good to go. Now, I'm gonna put one finger here. What I want you to do is touch your nose and then touch my finger. And then alternate hands. Okay, other hand. Good. All right, take your left heel and run it down your shin. Perfect. Now your right heel. Good to go. All right, close your eyes one more time for me. I'm gonna put something in your hand and I want you to tell me what it is.
A key?
It is a key, all right. Got one more for you. It's gonna go in your other hand. What is this?
A pen?
Okay, it is a pen. Keep your eyes closed. I'm gonna draw something on the top of your hand. Not really, just touching you. And you tell me what it is.
An 8?
Other hand.
A C?
Let's do that one more time.
Oh, an A.
It is an A, okay? I'm gonna do the same thing to your feet.
A circle.
It is a circle.
A D?
One more time.
Oh, a triangle.
It is a triangle. All right, so graphesthesia and paresthesia are intact. So far so good for your range of motion, your strength, and your neuro exam. So a couple more tests standing up. I know your gown is kind of unbuttoned, but sorry, I'm not choking you. All right, so what I want you to do is, when you're ready,
Just tie it.
when you're ready, I want you to stand on one leg and bend forward, putting the other leg behind you. So you may have to rotate so you're not kicking the bed. All right, and other leg. Good. All right, so I want you to walk heel to toe towards the camera for me. Okay, you can turn around and come back this way and walk on your toes. Good. All right, stand with your feet shoulder width apart. Don't lean on the bed for me. Close your eyes and just stand there. Okay, so he is not leaning or tilting, so everything is in balance, and your neuro exam checks out full range of motion and full strength in all your joints. So that is good. We just have one more thing to do. I want you to dangle your feet off the bed again. Sit on the edge for me. Okay, so we're gonna check your reflexes. Try not to kick me over. Okay. 2+ there. Okay. I'm gonna check the back of your ankles here. I'm just gonna give them a little tap the same way. And your foot jerks just a little bit up. So I would say these are 2+ and this is about a 1+, okay? Just relax, relax. I'm gonna tap your wrist. Little bit of supination there. One more time, there we go. Okay. And on this one, you're gonna have to relax real good for me. And I'm just gonna hit my finger, okay? While I have your brachial tendon relaxed or compressed. Relax, relax. Try not to get in the way of the camera. This makes it hard. Relax. Relax your shoulder. to get it to dangle. There we go. All right, one more. I'm gonna work on that tricep back here. This one's hard because you have your shoulder flexed back, so really try to relax that shoulder for me, okay? Relax. Okay. A little bit of a reaction. It's a hard angle. All right, relax the shoulder. Just let that arm dangle. All right, we did get a little jerk there. So, all right, deep tendon reflexes are all 2+, minus I would say our wrists were not supinating a whole lot. So I would give them a 1+. Any questions or concerns? Okay.
Is that all you have?
That's all I have.
Are you sure?
I am. No, we did not do range of motion for your spine. Please stand up. Okay, so I'm gonna have you hands on your hips, lean to the left. Okay, lean to the right, lean backwards. Okay, don't fall. A little popping and cracking, but that's okay. And lean forward. Can you go all the way down? Okay, and spine is midline. And the scoliosis.
Maybe you could turn off the video.
Now I'm done.